Hello, hi everyone. This is the new charting that we're going to use starting in February. This is weekly charting, so it's different from the monthly charting we've been doing. And the other big difference is that the charting here is vertical. So, for example, Sunday will be charting down instead of charting across. So let's say I'm working Sunday day shift. I'm going to come in here. This is the day shift / morning care, and I will record how much my resident ate for breakfast. Let's say 50%. How many ml of fluid they drank, maybe 300 ml. And percentage they ate for lunch, 100%. How much water they drank for lunch, 500 ml. Dinner, maybe dinner they only had 25%. And for dinner they drank 100 ml. And then we move to bowel movements. So here, the biggest aspect is making sure that our residents are not constipated and we're being mindful of what we're charting. So if I say that my resident did not have a bowel movement, so I would say 0. They didn't have a bowel movement. Or you could say, actually, not applicable. I think not applicable. Well, it is applicable. Let's say 0. Let's use 0. So if no bowel movement, we put 0. And then date of last bowel movement. This is where the accountability comes in. You have to know if you're charting they didn't have a bowel movement. You have to know when their last bowel movement was. If it was 3 days or more, that should prompt you to go and give them the PRN medication for constipation. So the date today is January 28th of 2026. So if I was to look back at the records, this resident maybe had a bowel movement on January 25th of 26. So that's precisely 3 days ago. And so at this point, 3 days of no bowel movement, I'm going to open the resident's MAR and see what they have for constipation, and I'm going to administer it and chart it on the MAR. And at the back of the MAR, I'm going to write no bowel movement for 3 days. Okay, and then here's pericare. So I will say yes, I did pericare. And again, the times are 6 a.m., 10, 2 p.m., 6 p.m. And ideally, in a 12-hour window, the residents need to be toileted a minimum of 4 times, every 3 hours at minimum. And of course, if they poop in between or they overflow their briefs, change them in between. And then here's the urine. C is for continent, if the resident can tell you they want to go to the bathroom. I is for incontinent, and then FC is for Foley catheter. So here I will say my resident is incontinent, so I'll put that they were incontinent. And did you give them a shower, a bed bath, or a sponge bath? That's what S is for shower, BB is for bed bath, and sponge bath is SB. So let's say I gave my resident a bed bath today. And in this question, the next paragraph is asking, did they get out of bed to the recliner or to the wheelchair? I'll say yes. They got up today, and maybe the next day they don't get up, then my answer would be no. They stayed in bed all day today. All right, we get down to oral care. In the morning, did you provide oral care? Yes, I did. Lotion their skin? Yes, I did. Dress them in their morning clothes? Yes. Brush their hair? Yes. Did you clean their fingernails, toenails? Yes. Did you cut their fingernails? So today I didn't cut their fingernails. You can say no for that one. We have enough space to write no. Or you can just put N. Let's see. Let me add that. Yes / no. Okay. And then for evening time after dinner, did you dress them in their night wear or the gowns? Yes, I did. Did this person have an appointment today? And if yes, then document their appointment in the appointment log. So we'll say, yes, this person went to an appointment. Make sure it's documented in the appointment log. How many hours did they sleep during the day? As you know, some residents do lay down in between meals or when they're tired. So maybe this person slept a sort of 3 hours during the day shift. So put that 3 hours there. And then, are they having pain on a scale of 1 to 10? Try to ask the resident, on a scale of 1 to 10, how much pain are you in, and document that. And anything beyond 4, so let's say you said the resident was in 6 out of 10 pain, that is serious pain that needs to be followed with medication. So if you're saying the resident had 6 or 5, let's say 5 out of 10 pain, anything more than 4. Did you give them some Tylenol? Did you put on a lidocaine patch? Do they have some kind of pain cream that you apply to the area that hurts? Anything beyond 4 needs to come with medication and repositioning for comfort and all that stuff. So that's that. And then this is the night shift charting down here. How many times were they up at night? My resident was pretty good. So 0 times he was not up at night. Bowel movement. He had diarrhea at night. So that would be a D. And then, last bowel movement. So they didn't poop during the day shift. Day shift gave them some medications for constipation. And then in the night shift, they pooped. So then, date of last bowel movement, I will put this down here as today's date, which is 1/28/26. And so then the person who is documenting the next day, on Monday, when they get to the bowel movement part, they will say maybe 0, the person did not poop. But when they ask when was the last date of their bowel movement, that's a 25th. And down here is the 28th for night shift. So I'm going to take the night shift date and I'll put it up here, 1/28/26. This is just so we're all on track and our residents are not having prolonged constipation, which could very well send them to the hospital if we don't catch it in time and fix it in time. So that's that. Let's see. All right. And then they were incontinent during the night. And similar to what we've been doing, you have to take accountability for your work. So everything that you chart, you have to put your initials. This column here that says caregiver, that's the caregiver initials. So I will go down in a column here and add my initials to all of this charting and take accountability for my work. Obviously, this is going to be paper charting, so it'll be handwritten. But you'll understand the gist of this. And then we'll get down here, taking accountability for my work. And this will be the night shift. It'll be somebody else. So let's say this is Iman. So she'll put her initials there and down there. And that sums up what the charting is going to be. And again, this is weekly. Oh, another thing I forgot to mention, since it's weekly, the week begins on Sunday, ends on Monday. So for every new week, we will put in the date. So let's say today is, we'll begin this in February. So 2/1/26, we have to write in the date and put it across the board. Make sure you're putting in accurate dates. 4, 5, 6, and 7. All right. So this will be my week, and once we get to Saturday, everything is done. Then we move to the next charting sheet for the next week, Sunday to Saturday. And again, the date of the last bowel movement, look back at the previous sheet. So that would be looking back on Saturday of the previous week to see when was the last bowel movement for the day shift documented and what did night shift document. And then if they have a bowel movement on Sunday, update the date. If not, carry that date into the next week, because we want to be very accurate about the care that we're providing for our residents. And then at the top here, we'll put their name. So if this is Jane Doe, we will write Jane Doe up here. I hope this video helps and makes sense. Down here, everybody will put their initials. Just because everybody has such a different handwriting, it will be easier to track who documented what, whose initials match the initials down here. So this is mandatory for everybody to initial down here, and then keep charting throughout the week. Let me know if you have any questions or need any further assistance regarding this new charting. Thank you. Bye-bye.
What?
Turn it off.
Press the stop button.